associate needed in Arizona. I'm here with Dr. Sean Reed, an amazing practice owner that needs help. He's got too many patients and too few dentists. Thanks for joining me here, Dr. Sean. I want to share your position on Dentist Job Connect. People can find it by going to dentistjobconnect.com or texting AZ to 215-798-9897. So we're going to start with this, Dr. Sean. You're looking for help out there in your dental practices. Tell us a little more about that.
Well, our practices are in and around Prescott, Arizona. It's a beautiful area. I've been there about 11 years myself and really love the area. We've got 3 offices in the area. As Paul mentioned, we just don't have enough doctors right now. So we've got a team of doctors. We're looking for a couple of other doctors to join us as well. It's a great opportunity for I say general dentistry, and I really mean that. I think we do a little bit of everything, including some specialty services. We have a orthodontist, so orthodontic specialist on our team who offers a mentorship to us general dentists.
Orthodontists were the smartest of the group. You want to know why? Because they're not even dentists, right? They're better than dentists. Want to know why? No injections. You don't give an injection.
I know.
I don't think you can be a dentist. Yes, I'm very jealous, right? No injections. Not once do they have to deal with holding a needle in front of them. I know maybe a few of them place TADs. They'll say that's not what they do every day. So tell us a little about this. I know you were collaborating with one of my amazing friends, Dr. Mark Costas. Tag him here. So he's in Prescott. So that's where these practices are. So this is in Arizona, Prescott, Arizona, but you have 3 locations. Okay, 3 locations. Would you describe one of them as semi-rural? Is that the right way to put it?
Yeah, I'd call them semi-rural. We're an hour and a half north of the Phoenix area, so it's distant enough that it's not suburban at all, but for Prescott's a decent size too. So
you can go hang out in Phoenix on the weekend and do stuff if you want to.
That's actually where I am right now.
Oh, nice, awesome.
So that's exactly right. We'll find ourselves down here once in a while.
Nice. Now, these dentists coming out of dental school, you graduated 2011, 2002 for me. I don't know if you've noticed, price of dental school, quite nacho nuts, right? Just keeps going up and up and up. So let's say I'm a dentist saying, hey, you're a super awesome guy. You got a group practice. I'd love to do general dentistry, learn ortho. What type of compensation is reasonable for me to expect? Maybe I'm going to move across the country. I have to pay my loans. These young dentists, they're so entitled, Sean. You know what they really like? They like eating and paying rent. That's such an entitled life that they have. I'm just joking. They have a lot of challenges with their debt, but also a lot of opportunity. But let's say they want to dig into your job and say, what's the income expectations? What would you say to that?
So I've looked back myself at our most recent doctors that we've had in each of our offices. And over the past few years, each of our doctors have made over $200,000 a year.
Awesome. We've
had a couple that have made over $300,000 a year. The variance, of course, depends on what skill level you come with, what procedures you're prepared to offer now. But that's one of the things I feel is so important especially in a group practice setting, is the opportunity for mentorship. So
yeah.
So whether or not you come prepared to do implants or Invisalign or specialty services, that's something that I feel we can help you learn. So
I think it's awesome. I mean, mentorship really matters. Dentistry can be an incredibly lonely profession, even though you're surrounded by people, because we have 2 practices, Sean, and for a while on Thursdays I was running the solo GP practice by myself, right? And it is having to answer all the questions, do all the work, and not having someone you can rely on. And being able to rely on someone, it could be through FaceTime, it could be through text message, it could be through somebody being able to go over at lunch and check out a case with you. So I think mentorship is such a key part to maintaining your sanity at any level, but especially as a new dentist. And what I think new dentists don't realize is it's often not, is my crown prep margin okay? It's more, this patient said XYZ, how do I deal with this? I've never heard of this before. And I think that's why when you have bigger, stronger, older dentists around, it just creates a opportunity to feel secure. Is that something you've noticed in your career?
Yeah, absolutely. I think what I didn't realize early in my career is how important that mentorship was. And so now, being able to offer that through a number of different people on our team, I think that's just such a asset, such a blessing for a young dentist. And it comes in a variety of ways, like you said. It might be side by side.
I wanted to interject. I would say interject. I don't interrupt. Just interject with good ideas. But what you were thinking there or sharing was, even if you do 180 extractions and 200 fillings and 50 crowns, the number of patients you see in dental school, it's just such a small number, right? The number of people. And then once you're into the real world, I mean, I think it's important to share. I mean, how this associate, will they be checking like 1 or 2 hygienists, also doing some restorative work? What's their day going to look like?
Yeah, very much like that. We've got 1 to 2 hygienists in the office at the same time that we might have 1 to 2 doctors. So the days might vary a little bit depending on whether or not there are 2 doctors in the office at the same time. The offices are equipped enough that we've got enough operatories to have 2 doctors and a couple hygiene rooms at the same time. So we're flexible in being able to be productive and have those hygienists at the same time, but it'll involve a full day of hygiene exams as well as the restorative work that they're scheduled for.
Awesome. And I just think it's these opportunities working with small groups can just be so magical for a dentist at any age of their career. But let's say you're out of dental school for 2 years, you worked in a few places, and you want to not only learn about the clinical care for patients, but also how practices are run, how owner dentists deal with challenges. You don't have any challenges in your practice, right? Everything runs smoothly all the time.
I don't know what you're talking about.
Yeah, that's right. Your phone never goes off at 7 a.m. that you don't want to look at that text message. Owner dentists should never answer their phone before 7 a.m. Not once has it been good news. Oh, you're handsome. The hard way. I can't wait to get to work because you're so funny, Paul. Nope. It's, hey, just want to let you know one of my children is sick. And those are the things you have to deal with. You have an awesome team, but they have a life outside the office. And I think when you can be an associate inside of a group practice where you see not only what happens inside the operatory, but also get context for what happens outside the operatory, you're able to do that in an environment of support, security before you go on and own your own practice. Because what I think is cool about Dentist Job Connection is, why is one of the reasons you're looking to replace one of your associates? What did that associate decide to do after working with you?
Yeah, so I shared with you that one of our doctors decided to pursue an orthodontic residency. Which we congratulate her for and want to support her in that, and we're excited for her.
You caused your own problem by being so darn helpful, right? And I always share, when people move on, congratulate them. I mean, I think what we're doing here is sharing how important it is to create systems to replace key people in your offices and associates of those people. Dentist Job Connect strives to get you those candidates. As we wrap up, anything else you'd like to share about the position? For your 3 offices, your multiple offices, you're looking for actually 2 associates, you have room for 2 associates, but anything that I missed as we wrap up?
Didn't miss anything. I think we'd kind of mentioned it's a group practice setting. One thing that has always been important to me, and I think would be appreciated by many, is that while we're looking for a couple of doctors and we've got multiple locations, I think continuity of care for our patients is critical. And so we support one another within the practices or within the locations. Sometimes we might be scheduled at more than 1 location in a week, but for the most part, you would expect to have a home base. And I think that's important for the team and for our patients. So
I can tell you provide experience, you provide enthusiasm, you hit these marks of the money, the morale, and the mentorship. So check out this position with the awesome Dr. Sean Reed and his team in Arizona. You can text AZ to 215-798-9897 or check this position out on dentistjobconnect.com. Thanks so much for sharing with us, Sean.
Thank you. Appreciate it. Thanks, Paul.